Welcome to the deep dive. Today we're stepping back, way back to 1914.
Yeah, imagine that world on the edge of huge changes, but still figuring out how to handle, mental and nervous issues.
Exactly. And they were using this blend of, well, early science and really human interaction. Our guide today is Dr. Edwin L. Ash's How to Treat by Suggestion with and Without Hypnosis. It's subtitled A Notebook for Practitioners.
Right, and this isn't just some dusty old book for you. We're aiming to give you a real shortcut into understanding psychotherapy back then, early 20th century.
We're focusing on the practical side, aren't we? Less theory, more.
Oh,
What do they actually do?
that's the core of it, though what happens over the why it happens. We'll dig into some surprising facts, some really vivid case studies.
And hopefully you'll get some aha moments,
Yeah.
connecting Ash's ideas from over a century ago to how we think about well-being now.
So, this Dr. Ash, who was he? He wasn't just anyone. Director of the London Nerve Clinic, wrote quite a bit, books like Nerves and the Nervous, mental self-help.
But this specific notebook, he was very clear who it was for, wasn't he?
Absolutely. Solely for the medical profession. This wasn't pop psychology for the masses. It was a practical manual for doctors.
And that practicality, that's kind of his whole angle here. He says up front, he wants to summarize practical rules. Basically, what do you do and how do you do it?
Yeah, he even compares it to doctors using drugs. They know what the drug does, maybe not always the deep why. It's very outcome focused.
So what does that tell us about his approach to healing? It sounds very hands-on.
Extremely. He wasn't waiting around for all the scientific answers. If a method seemed to work, if it got results, he was interested. It's like, surgeons operate successfully even before understanding every single microscopic detail. He saw that effective practice often comes first.
Okay, so let's put hypnosis aside for just a minute. Ash believed a lot in suggestion without altered states. What was maybe the most basic method he described?
Well, it starts incredibly simple, the power of touch. Methods 1 and 2, he calls them simple manual contact and simple passes.
Simple contact. What did that actually involve?
For things like, say, feeling run down, depressed, or even local pain, the doctor would just place their hands on the patient's head, or maybe gently stroke the body, for maybe 5-10 minutes, just asking the patient to close their eyes, relax.
Just that. No deep talk, no complex instructions, and people felt better.
Apparently, yes. Patients often reported feeling brighter, stronger, more self-confident. Local pains eased up. Ash himself pointed out that this laying on of hands has been used successfully for like 3,000 years in mental healing.
He called it the simplest form of psychic treatment.
Right. And what's really interesting, almost counterintuitive, he notes that you didn't even explicitly need verbal input for this to work.
No words needed. So what was going on there, according to him?
It suggests he was tapping into something profound about the mind-body link, even without our modern jargon. Maybe it was about creating a space, a psychological space, where the patient's own healing could kick in. Focused attention, human connection. He called it autogenous suggestion, self-generated. The patient's mind doing the work in that calm state.
Fascinating. Okay, so from that very subtle approach, he also moved into more direct methods, adding words. Tell us about method 3.
Method 3 brings in verbal suggestions. So you combine the manual contact, the passes, with specific, strong verbal cues tailored to whatever the issue was.
Got an example?
He gives a great one. A 16-year-old girl training to be a teacher. Suddenly lost her voiceophonia, likely due to anxiety. Ash put his hand on her throat, gave very strong suggestion that her voice would return. She was just standing there, eyes open.
Wow.
The result. Eminently satisfactory, he writes. Her voice came back. She could go on with her training.
Wow. That's pretty direct. And method the 4th, that relied just on words.
Yeah, method the 4th was all about the power of direct verbal commands, especially for people maybe anxious about having some underlying physical disease. The doctor would earnestly repeat things like, "You are physically sound, you will live health."
Trying to plant that idea firmly.
Exactly, trying to get past the conscious worrying mind straight to what he termed the subconscious or subattentive mental field.
Any cases for that one?
He mentions a 22-year-old man, a vegetarian who had general nervousness, really lacked confidence around strangers. Just 3 sessions of these verbal suggestions with a hand on his forehead. The guy declared himself cured.
It's striking how much confidence Ash had in these focused approaches. Now, among all these waking methods, he had a favorite, didn't he? Method 9. What was special about that one?
Method 9 was a bit more involved. The patient rests, eyes closed, relaxing mind and body. They're encouraged to realize yourself as a mental and spiritual self rather than as a physical self.
Okay, that sounds deeper.
It is, and the practitioner places a hand firmly over the epigastrium. The upper abdomen area maintains this really restful, confident attitude, mentally pictures the patient as healthy, and then adds occasional verbal suggestions.
And why was this his go-to? The most useful of all procedures, he called it.
Because he felt it went beyond just fixing symptoms. He believed it could raise the mental and even spiritual level of the patient's whole life. It was about conveying sympathy, belief in health, belief in certain mental and spiritual attitudes.
So the practitioner's own state of mind was key here.
Critically important. He even says this method is not for doctors with a materialistic philosophy. It implies the practitioner's belief system, their inner state, was part of the treatment. That's pretty ahead of its time, thinking about therapeutic presence back in 1914.
That is profound. Can you share a case where he used method 9s?
Sure. A 24-year-old commercial traveler became neurasthenic, sort of severely fatigued, anxious after his father died. He was plagued by disturbing thoughts and obsessions, even felt like he was seeing visions.
And method 9 helped.
Just 2 sessions, plus some exercises to do at home. The man reported perfect freedom from my distressing delusions.
Incredible. These waking methods alone are really insightful. But of course, the word hypnosis looms large over this era. How did Ash approach those deeper altered states?
Right. He definitely explored them. He described several ways in. Method V was what he called the hypnoidal state.
Hypnoidal, not quite hypnosis.
Exactly. He described it as a rest state where suggestibility increases. You get there through quiet monotony, kind of drifting towards sleep. The mind wanders. It isn't fixed. Interestingly, he often used electricity to help induce this state.
And come back to the electricity. So the hypnoidal state is like a gateway. Deep relaxation, more open to suggestion, but still sort of aware.
That's a good way to put it. It's less intense than full-blown hypnosis, often a stepping stone.
Okay, then the classic image. Method 6. Hypnosis by fixed gazing. Braid's method.
Yep. The patient stares at a bright object, a coin, a ring, a special hypnoscope held up slightly above eye level. While staring, the practitioner gives suggestions of drowsiness, sleepiness. Ash's phrase was that the goal was to write on the blank exposed page of the subconscious.
Did he have success with that?
He gives a case of a shop manageress with severe eyelid twitching, so bad she couldn't actually keep her eyes open for the fixed gazing.
So what did he do?
He adapted, told her to gaze as long as she could, then close her eyes and just concentrate on the image of the object. Daily practice, and he reported remarkable improvement. Symptoms vanished. Shows you gotta be flexible.
Definitely. And for people who didn't like the eye gazing, method 7.
Method 7 was hypnosis without fixed gazing, purely verbal. Suggestions of sleep, counting down, using just sound to guide the person into that receptive state.
Ash also talked about different stages or depths of hypnosis, right? Like a spectrum.
Yes, a gradual deepening. It was important for the practitioner to know where the patient was on this spectrum.
So what were the stages?
It started pre-hypnotic, just drowsy, passive, maybe a little eyelid flutter, suggestions already starting to work better. Then came early hypnosis. Deeper drowsiness, awareness of the surroundings fades a bit. You might get muscular effects like being told you can't open your eyes and you can't. Even sensory changes.
And deeper still.
Then the dream state. He called it semi-conscious. The mind wanders. You can suggest dreams, guide them through imagined scenes. The person is still somewhat aware, but very suggestible.
And the deepest level.
That was somnambulism, only achieved by maybe 10% of people susceptible to hypnosis. Here, consciousness is deprived. The person's will is largely guided by the operator. Crucially, they usually have no subsequent recollection, amnesia for the session. They could perform complex actions, live entirely in a suggested reality.
Understanding that range must have been crucial for tailoring the therapy.
Absolutely. Knowing how blank that screen was, as he put it.
Now, Ash was also keen to bust some myths about hypnosis, even back then. He pushed back against the idea of it being some kind of willpower battle, didn't he?
Strongly. He hated that popular conception. He insisted success depended rather more on the wish of the subject than on the will of the operator. It wasn't about domination.
So what was a key in his view?
Getting the subject to focus their attention, to quiet their own internal chatter, their stream of thoughts. That creates the blank screen needed to project new ideas or images onto. It really highlights the patient's active role, their cooperation.
It's not mind control, it's guided focus. And he had proof that subjects kept some agency, even deep down.
Yeah, a fascinating case he called Subject B, a young guy, a teetotaler. Even when deeply somnambulic, supposedly under full control, he initially refused an imaginary glass of beer Ash offered him. He even argued when Ash tried to suggest white paint was milk.
Huh. So even in deep trance, the underlying values or sense could resist.
It suggests they possess considerable initiation if he likes to exert it, as Ash put it. They aren't just robots. But he still saw hypnosis as a powerful therapeutic agent, especially for things like pain, where you could make the idea of no pain dominant.
Though he did note some practical issues.
Right. Hard to do in a busy hospital ward, too many distractions. And getting someone to full hypnotic anesthesia for surgery usually took several sessions, which wasn't always practical in a hospital compared to private practice. Context matters.
Okay, this brings us to something really unique in Ash's work. Method X, the psychoelectrical treatment, combining suggestion with electricity.
Exactly. He was looking at conditions like neurasthenia and psychosthenia, I think chronic fatigue, deep anxiety, maybe what we now see as psychosomatic issues. He saw them as having both a mental state of unrest and a physical lowering of tone.
And he had a theory about the gut connection.
Yeah, the popular idea back then of autointoxication, that toxins from poor digestion could affect the mind and body. He felt purely psychological or purely physical treatments often missed the mark for these complex cases.
So his solution was integration.
The best results may be anticipated from a combination, he wrote. His setup involves seating the patient comfortably on an insulated platform. They were connected to a static electrical machine, getting a mild head breeze.
A head breeze of static electricity
Yeah.
while relaxing.
Yeah. With instructions to relax, close eyes, focus on breathing. It sounds wild, but he had clear goals.
What were they aiming for with this combo?
3 things. 1, mental rest and relaxation. He found the electricity helped even very restless people find deep calm. 2, increased suggestibility. It helped induce that hypnoidal state we talked about, not full hypnosis, but very receptive. He felt it let patients tap reserve stores of energy.
And the third objective, the physical part.
3, physical and tonic effects. He believed the electricity itself had benefits of affecting nerves, aiding digestion, combating that autointoxication. It was a genuinely holistic approach for 1914. Mind, body, suggestion, all working together.
And he used this for a wide range of issues.
Incredibly broad. Obsessions, severe depression, he mentions, preventing someone from needing institutionalization. Chronic headaches, indigestion in an army officer, even a student's stammer before exams.
And even more physical-seeming problems.
That's what's really striking. A young woman with a hysterical contraction of the right knee joint. Doctors were considering amputation. Ash treated her with ferratic electricity, that's a pulsed current to stimulate muscles combined with suggestion. She regained her ability to walk.
Wow. Ferratic electricity.
Yeah.
So stimulating the muscles directly while giving suggestions.
Seems like it. The electricity wasn't just physical, it likely enhanced the whole process, the receptivity. It truly was rest, electrotherapy, and suggestion integrated. He also mentions a boy with frequent epileptiform convulsions seeing significant improvement.
It really underscores his commitment to finding what works, regardless of how unconventional it might seem now. So, boiling it all down, what were Ash's key principles for making suggestion effective?
He had some very clear guidelines. First, he categorized suggestions. There were suggestions about physical states aiming to relieve symptoms like, you have no pain, you will sleep tonight.
Straightforward symptom relief.
Right. But the second category was mental states, promoting positive qualities, tranquility, self-confidence, brightness of outlook. And he found this group by far the most useful for psychotherapists.
So building inner strength, not just chasing symptoms away. That feels modern.
It does. It's about fostering resilience.
Right.
And even for severe pain, like from cancer, he saw suggestion working 2 ways, both raising the powers of resistance to pain by increasing the mental tone and providing direct inhibition of the pain.
A nuanced view of pain. What about how to deliver suggestions? Any tips?
Oh, yes. Crucially, use positive phrasing. Suggest the healthy state you want, tranquility, not less restlessness. Be clear, to the point, sound confident and authoritative. Speak firmly, but not shouted.
Okay, tone and framing matter. Anything else?
Pacing. Don't crowd the suggestions. Leave pauses. Let them sink in. Not too crowded one upon the other, he said.
And finally, the practitioner's own state.
Absolutely critical. The therapist must maintain mental and physical calm, be thoroughly confident. And this is key, ensure they themselves are not influenced by the morbid suggestion of the patient.
So the therapist needs to hold their own positive, grounded state.
He actually warned that an anxious patient could easily influence a tired, negative doctor. It speaks volumes about the subtle dynamics in that therapeutic space.
What an incredible journey through Dr. Ash's 1914 world of suggestion and hypnosis. From the simple power of touch, through focused verbal commands, the nuances of altered states, right up to combining psychology with, well, electricity.
It really reveals this very nuanced, patient-focused approach. He was balancing practical results with a deep, if perhaps intuitive understanding of the mind-body connection, way ahead of his time in some respects.
And isn't it interesting? Ash, over a century ago, was all about the what happens, the practical effect. Yet underlying all of it, the success seems to hinge on these deeply human factors. The therapist's confidence and calm, the patient's willingness, the sheer power of focused attention and belief.
It really makes you think. Today, with all our neuroscience, our advanced medications,
Right.
are we maybe sometimes overlooking the enduring power of these, let's call them non-pharmacological factors? Things like directed attention, real human connection, tapping into a person's own capacity for self-suggestion, the very things Ash was exploring back then.
It's a compelling question. What might we still be missing in our modern pursuit of well-being? What stands out to you from Ash's work?